All right, we discussed previously nutrition in pregnancy or around that time, even though your book calls it slightly different name. And this chapter has a different name as well, but it's the same thing, infancy and adolescence. So there's a lot of growth, especially in the beginning. So the weight in the first 6 months of life, their weight is going to double. And by the end of the first year, their weight's going to triple from their birth rate. So a lot of growth. So their energy needs, their metabolic needs, like pound for pound, are twice as much as it is for us, right? And then in proportion to their body, their brains are a lot larger than ours, right? So I don't know if I said this, but the brain operates with glucose. The rest of our body can use a molecule called ATP, which we'll get to, but the brain doesn't use ATP. The brain uses glucose. So it's important that they get a supply of glucose. It's important that they get adequate hydration because their body has a larger percentage of water, probably close to 75%. And that water is what we call extracellular. More of it is outside of the cells. So they're much more prone to dehydration. And then a third thing I would say is protein. Again, I keep pushing protein, but protein needs are going to be a lot. So breast milk, there's no substitution. It's digested much better than formula, and there's tons of studies out there correlating breastfeeding to lower cases of illness, um, better cases of like adjustment, better performance in school. There's like all these indicators. So what's in breast milk? Well, it's a perfect balance for the baby. So it's about 40% carbohydrates, but it's not the quantity, the ratios. It's what kind of sugar is in there. So lactose is the principal carbohydrate, and lactose promotes calcium absorption. So it's like a good quantity of carbohydrates, but it's also the right type, the good quality of carbohydrates. Protein is about 6% of the milk, but it's related to albumin, lactoalbumin. Right now, albumin is the egg white. So I've said before that the egg whites are like the perfect protein. So this is like really the perfect protein. Alpha lactalbumin is like better absorbed than albumin, which albumin is considered the perfect protein, like the egg white. So easier to digest, less difficult on the kidneys, and then lipids. Big portion of breast milk is lipids. So babies take in a lot more fat than adults. So about more than 50%. But what again? Quality. What kind of lipids? So remember, there's four types of lipids: stearic acid, oleic acid, linoleic, and linolenic acids. The two that were essential were linoleic and um, linoleic and linolenic. I had to think about it for a second. In other words, omega 3 and omega 6. That's what breast milk is. It's all of that. And it's not any of like saturated fats or even monounsaturated. Right? But it also contains something else called arachidonic acid. It also contains another type of lipid called DHA, and those are important in brain development. So let's talk about vitamins. Perfect amounts of calcium and iron, high quality, high bioavailability, meaning that it gets absorbed and digested very easy. So not a lot of sodium. Of course, there's no fluoride or anything like that in breast milk, but you don't need fluoride at that point. So immunity. There's a few things. So colostrum is what's delivered the first few hours a day. So that's rich. That's a serum rich with antibodies, white blood cells. Breast milk sterile. There's a few things. There's a few proteins that are in breast milk that are very advantageous. So one's called bifidus factors, and they promote the growth of something called lactobacillus bifidus. So you want this in the GI tract because you don't want other harmful bacteria to get in there and start colonizing. So you want to keep bacterial bacteria out of your intestines. You want to keep viruses out of your intestines. So bifidus factors are going to they're going to promote certain bacteria like the symbiotic bacteria, their growth, but that's going to try to displace any other bacteria that are going to grow in there. And then there's another protein called lactoherin, which is a virus fighting protein. And then finally, there's something called lactoferrin, and that's similar to something we have called transferrin. So it binds to iron because a lot of pathogenic bacteria use iron to grow, and so as adults, we use transferrin to take iron away from like the pathogenic bacteria. In breast milk, it's called lactoferrin. It's very similar. The advantages of formula is that it requires requires fewer feedings. But sometimes, there's like a money issue. You notice that this stuff's locked up at a lot of places. It's expensive. And so some people dilute it. Some people start mixing milk in with it, mixing cow's milk in with it, which you can't do at that age. And primarily because of the type of protein that's in breast milk versus like cow's milk. And then there's also a lot of studies leading formula-fed babies to have more nursing bottle tooth decay, and that's characterized by like the upper front teeth. That's where it's gonna hit. So when do you give cow's milk? There's like people have different opinions, but not before a year. Everybody agrees on that. But okay, so here I'm telling you not reduced fat. But then there's like 10 years ago, I would definitely tell you, don't do reduced fat. Give them whole milk at 1 year of age, 2 years of age. But now all the recommendations are saying, well, probably give like 1% or something. So they're starting to change all of that. When to give solid foods? Within 4 to 6 months, you can start giving solid foods, but certain solid foods, right? So I want you to look in the book because it has like a list. You don't give them meatballs. You don't give them grapes. There's like I probably have a list on one of my slides. So here's a short list of some things to stay away from that you might not think. Corn syrup, honey, and I wrote the reason right here. You don't want to introduce overly sweet foods at this point. You don't want to introduce sugar, alcohols, because in young babies, toddlers, it can cause diarrhea. You definitely don't want to start off with too much milk. Remember, calcium is going to interfere with iron absorption. So this is a rough estimate of how many calories your children need. At 1 year old, about 8,000. At 6 years old, they are almost about what we need. They're about 200 calories less than what I would need at my age. So again, like we used to say that children will eat when they get hungry, and just let them eat when they're going to eat, and don't try to limit fats. Don't try to put them on diets that you might put yourself on. Now they're starting to change, and so I don't know. I don't think your book knows. So here's some foods to avoid, right? Hard foods. Hard for not just hard candy, but hard foods for anyone under 2 years old. So we're talking about things like peanuts and apples and anything stringy because that's going to get stuck. Celery is like a really good example. Like celery and peanut butter is a horrible snack because you've got like a stringy food and then you've got a sticky food. Peanut butter is a sticky food, and then anything plug shape. We call it plug shape. Hot dogs are excellent. They fit just perfectly right there in your trachea. So, none of these plug-shaped foods. So what are the nutrient needs? Again, you see some reoccurring themes here. Iron, vitamin D, but I'm adding something in here, fluoride. Right, so if you have well water, you're going to need fluoride. If you have municipal water, it's not a big issue. And if you remember when I talked about fluoride, it could cause fluorosis if you give too much. So if you're on city water, Even if they're not drinking the city water, but you're cooking with it and stuff, don't go buying the gallons of fluorinated water that they sell at the store. Um, Diet and behavior. So remember, the brain uses glucose. So when you don't feed children, they run out of their sugar stores in about 4 hours. That means their brain's not getting food. So their brain's starved for food and they're not going to perform as well. And they're going to start acting out. And about 13 to 15% of children don't eat breakfast every day. That's why the schools have these breakfast programs, because that you get better behavior, you get better academic performance. So, um, so that's an issue. There's a lot of studies linking higher iron levels with cognitive and behavioral issues. But I don't know. Last time I checked, it wasn't like it wasn't conclusive. Right? But that's just the thought. There's like a lot of people thinking that, but what people agree on is that there's no relationship between sugar and hyperactivity. It's just that you might notice a lot of these times where they get like cake is like some kind of party or something. So kids are just acting like kids. So now in adolescence, it starts to become things become a little bit more different. You're going to get body fat changes. So like you're going to start get like a separation. So now you're getting more body fat in women and more lean body mass in men. But you still see here vitamin D, calcium, iron, right? But now here the iron is going to become even more of an issue for women. As soon as you start menstruating, iron's an issue, and it's going to remain that until you're in menopause. Right? So the iron needs go up from like 18 milligrams to whatever I put in that lecture, I forgot. Right? But they go up. They go up like 1.5 times. Right? Calcium needs are often not met by teenagers because they don't eat well. You can't just eat ramen noodles all day and meet your calcium needs. So they should be getting 1,500 milligrams of calcium, and most of them are not meeting that. So that's going to affect peak bone mass. And then once it affects that, so when you affect peak bone mass, when you bring that back earlier, that's going to, like, once you get in like the 50s, that's going to lead to like osteomalacia, not so much osteoporosis, but osteomalacia. So yeah, so they tend to, people at that age tend to drink more soft drinks than milk. So that's my last slide. So there you go. I got one more. We're going to look at old people, and with let me just click off this. All right, so with these people, they're growing. So they're going to need calcium. They're going to need a lot of protein. They're going to need iron, things like that. You're going to find with old people, they need the same things, but for different reasons. People, when you're 12, you're growing. When you're 70, you're trying to slow down decay. You're trying to prevent muscle atrophy, for example. That's why you need high levels of protein. With someone that's 12, it's because they're about to hit a growth spurt. So we will get to that chapter next.